Morning. We'll get started here in just a few minutes.
Hey, Darren.
Good morning or good afternoon. Sorry. Thank you for being patient.
Oh, no problem. I'm not sure why my picture's not coming up.
Try your down at the bottom, stop your video and try to go back into it, see if that helps. So we get going here.
Interesting. I don't have anything down at the bottom, Darren. I've got
Okay, well, let's go back over here and see if I can give you more. There we go. Let's try that.
yeah, join this panel.
You'd think that I'd get this stuff done after a while. I'd be able to figure this stuff out, but you know, sometimes I'm still a little slow. There you go. It's good to see you.
Good to see you.
So my name is Darren Hutton. I'm with the Division of Aging and Adult Services. I am the Senior Health Insurance Information Program Manager, which is the Medicare Education Outreach. With us, we have Marcel Larsen Jones. He is the Long-Term Care Policy Specialist. And what else has been added to your title now? Because you've been promoted.
Yeah, so I am the policy coordinator. So I help facilitate the publishing of policies with Department of Workforce Services and Department of Health and Human Services now.
So you're the coordinator. Sorry, I didn't mean to demote you down to the long-term care policy, which you still are. But at the same time, I should give you the right the title. So I'm sorry about that. And
No.
Marcel is here to help us today. He's going to help us with long-term care services and supports with Medicaid, because that is a topic that people want to know about and want to learn about. And so we chose this as something that we needed to discuss. Do you have your PowerPoint ready, or do you need me to pull that up?
I do have that ready, Darren. Let me share my screen here.
There you go.
See my screen? Okay, perfect. Let's go ahead and start from the beginning.
Okay, great.
Okay. Did you want me to go ahead and start, Darren?
Yes, just go right ahead, since we're running a little bit late already.
Okay, perfect. So the Utah Medicaid long-term care services and supports. This is a slideshow that talks about what long-term care is,
Marcel, right now I'm just seeing your background screen.
Oh, okay. Let's see. Stop.
There it is.
Okay, perfect. And then, can you see it now, Darren?
Yep, we're still seeing it. It's just, yep, now it's in slide presentation. Okay, great.
Perfect. Okay. So, what long-term care is, and then beyond Medicare, and then eligibility, that's for Medicaid specifically, and then qualifying for Medicaid when you're over either income or asset limits, and some suggestions there. So the introduction is that most Americans will end up facing the need for long-term care. And sometimes there's not a lot of understanding on what long-term care is and how to receive those supports and services. Oftentimes people think that Medicare will pay for all the needs, and that is just not accurate most of the time. So long-term care, who covers it? Well, when we talk about long-term care, we're talking about two different levels of care. So the first one is the custodial care. And so that's personal care given to individuals with help for activities of daily living, like bathing, dressing, things like that. Providing people, this is usually provided by people that are sometimes family members, or, it could be untrained professionals. Skilled care is a more, I guess, professional setting where people are medically trained. It's going to be your nurses, it's going to be your CNAs, it's going to be your speech therapists, things like that. Those are the people in the skilled care environment. So one can be at home, the other can be, in a more professional skilled nursing facility. Medicare coverage of a skilled nursing facility. So earlier in the slideshow, we talked about how most people think that Medicare can cover their long-term care supports and services needs. Well, when somebody goes into a hospital stay of 3 days or more, and then they need to discharge to a rehabilitation center or a skilled nursing facility, they have to be doctor ordered to go there, and they can get up to 100 days covered with their Medicare Part A benefits. So the first 20 is $0. 21 through 100 there's a cost associated to it. $176 co-insurance per day. So that is quite a bit of money out of pocket, even with your Medicare Part A benefit. Now, just because it can be up to 100 days doesn't mean that Medicare will cover all 100 days. If Medicare feels that you are no longer able to rehab what has brought you into the skilled nursing facility, they can stop the Medicare days before the 100th day. One thing that I would like to mention is that there are Medicare cost sharing programs that can pick up that $176 co-insurance. So we talked about the Part A. The Part B is the skilled therapies. So that is, occupational therapy, physical therapy, things like that. A home health agency, they can come into your home and try to help you, stay in your home and help you with those things. Again, these things all have to be doctor ordered and medically necessary, and you must be unable to leave your home without assistance. So that is basically what Medicare can and will cover. And, depending on what your needs are, if you have long-term care needs, it's not a lot. So who comes in, what can come in to help those people that have needs beyond what we just described Medicare will cover? Well, Utah Medicaid can help. Utah Medicaid's long-term care program. So what we have is we have a regular Medicaid state plan benefit. And for those that are in a nursing home or that get approved in one of our 1915C waiver programs, Utah Medicaid can cover some of those long-term care services and supports. So in a nursing home, that would be your nursing home daily rate. And so the co-insurance cost, or what we were talking about before, that daily rate can be covered by Medicaid if you meet the level of care and the need to stay in a nursing home. Medicaid also has home and community-based waivers, but these are only limited to a certain group of people. You have to meet the level of care requirements. There has to be spots available for you. And so that is a more limited benefit package to help people stay in the community or to have assisted living covered. We talk about regular Medicaid or age blind and disabled Medicaid, and anybody can apply as long as they meet one of those coverage groups of being age blind or disabled. You can apply, and that can help you with some of those state plan level services. But to get some of these additional services that we've just talked about, you need to have long-term care services and supports. So the state, to dive into the benefits a little bit more, state plan personal care services. So that's those assistances with activities of daily living, benefits with mobility, preparation of food, and these are real limited scope. But when you look at home and community-based waiver services, you can look at, caregivers being able to come into the home and help you with the aging waiver. And that's for individuals targeted over the age of 65 or older. And you can get a care plan to have personal care attendants or meal deliveries, home modifications. The New Choices waiver is another one that can help people with long-term care services and supports needs. And that can help people with assisted living costs. And as you know, people that are able to live in a lower level of care than a skilled nursing facility, it gives them more freedom of movement. It allows them to, in a sense, could have a better quality of living, or they could get, these new choices waivers at home. And that allows people to come in and give those attendant services and things like that. Okay. What are the eligibility requirements? So that is what the policy team, which I am a part of, we're in the Office of Eligibility and Policy. And so our role is to write Medicaid policy for eligibility. And then what happens at that point, once the eligibility has been written, it then goes to the contracted eligibility agency, which is Department of Workforce Services. The Department of Workforce Services are the ones that actually take the application and process the application, but it is with the policies that are made by the single state agency, which is the Department of Health and Human Services. Okay, so what are the Medicaid basic eligibility requirements? You have U.S. citizenship or qualified alien. You have to be a resident of Utah. And so when we talk about those two requirements in and of itself, most people think, I'm a U.S. citizen and I live in Utah. Don't I qualify for Medicaid? Well, those are only a couple of the basic eligibility requirements. Okay, you have to apply for all other benefits. That includes Medicare. So if you decided not to take your Medicare Part B plan during your open enrollment, you would have to enroll in Medicare Part B. If you are waiting to receive your Social Security, you would have to start those Social Security payments. And if you're a veteran of the United States Armed Forces, you have to apply for those benefits to see if you could potentially receive any benefits from the VA. The reason why is because Medicaid is the payer of last resort. So we ask that everybody apply for all the benefits that are available to them before looking at getting Medicaid services. You have to meet specific program criteria. So earlier in the slideshow, you'll remember how we put age, blind, and disabled. Those are coverage groups that will allow somebody to get long-term care service and support. So what does that mean? If you're aged, you're up over the age of 65. If you're disabled, then either Social Security or state agency has determined that you meet the disability requirements. You can be a resident of household or an institution. When we talk about an institution, a skilled nursing facility is considered a medical institution. So a household would be you're living at home. An institution, a medical institution specifically, would be if you're at a skilled nursing facility. You have to meet the income limits. You have to pay a spend down or a contribution to cost of care. And we'll get into that more as we move forward. Okay, this is an at a glance view of income and asset limits. Now, this is a chart that has been put together by somebody that isn't in Medicaid. However, it can be a good resource. Okay, so as you're going to look here, you're going to see the type of Medicaid. You're going to see if you're a single person or married. Now, the income and asset limits are very different if you're married versus being single. And that's why this chart is broken up in the way that it is. And we'll get into those differences a little bit more later on, but keep in mind that the income and asset limits are very different for long-term care when you're a single person versus a married. Okay, so as you'll look down, you'll see there's a nursing home row, there's home and community-based waivers, and then there's the age, blind, and disabled. So again, there's no income limits with the nursing home Medicaid, but there is an asset limit. And so when you do have an asset limit, we can talk about, the assets that are countable, those that are not countable, and, potentially what people can do if they don't meet these requirements. At the bottom, you say there's kind of a note that there's an exception of a personal needs allowance, which is true. If you're a married client or you have, you're expected to be long-term, you can only have $45 in personal needs allowance. Okay. If you're, however, if you're married, you can contribute some of those money, some of that money that you have coming in to the spouse at home. And we'll get into that a little bit more. Last thing that I wanted to point out with this chart is level of care required. Okay, so nursing home level of care, what does that mean? You have to be able to be medically necessary to be in a nursing home. So oftentimes I talk about income and asset eligibility, the basic requirements. You also have to meet the medical level of care. And the medical level of care in a nursing home is the nursing home level of care, as well as the home and community-based waivers. So you may ask yourself, well, if it's the same in the nursing home Medicaid as home and community-based waivers, that might not make sense, but it does, because home and community-based waivers are there to help you stay out of the nursing home. You have to meet that same level of care, but it's there to give you the support you need to stay out of that nursing home. Okay. So what defines income for Medicaid? Well, it can be any source of income, and a few of them, most common are Social Security payments, pension payments. It can be veterans payments. Sometimes there's employment and wages. It could be cash contributions. Those are all things that are considered as income. When one spouse applies for nursing home, only the income of the applicant is counted. So what we're trying to get at in this second paragraph is that the community spouse at home, well, let me back up a little bit. Okay, you have your institutionalized spouse, which is the person in the skilled nursing facility, and then you have your community spouse, the person that's at home. Okay, so what we're trying to get at in this second paragraph is that community spouse will never have to pay their income to the nursing home. We're only looking at that institutionalized spouse's income to see if there needs to be a contribution to cost of care. So when we talk about the institutionalized spouse, they can contribute money to that spouse at home. And you say, well, how is this possible? Well, that's with the spousal needs allowance. And we have a formula where we look at the community spouse's mortgage, their taxes, their home living expenses. We add it with a shelter. We add it with a standard utility allowance, and then we subtract a shelter standard from that and add it to the minimum monthly needs allowance. You're saying, well, that's great. I can contribute money to the community spouse. Oftentimes you can, but we do take into consideration how much income the community spouse has. So that will determine how much that institutionalized spouse can give to the community spouse, or they have to contribute to the nursing home for their cost of care. Okay. Excuse me. Income is counted differently when one spouse applies for regular Medicaid and the other one is in long-term care. So how is that different? Well, if both people are on Medicaid, let's say that both people are on nursing home long-term care services and supports. Well, we would look at them as two single individuals because they're both in long-term care. Okay, so it depends if one is on Medicaid. If your community spouse is on Medicaid, then they still have to meet the Medicaid requirements for the program they're on. So that's something to keep in mind of. Okay, well, let's talk a little bit about assets. There are a lot of assets that are available to somebody. I talk about them as liquid type of assets. Those are cash, stocks, bonds, things that can be easily liquidated. Your savings, your checking account, things that people normally have. But there's also private property that you have. So I'm thinking a home or a camper or, an automobile, things like that. And so we have all of these assets. And if you'll remember back, there's a $2,000 asset limit. Okay. But not all of those assets are countable for Medicaid. The assets that are exempted is an automobile, one vehicle that's being used to transport a person to their medical appointments, used for their needs, a burial plot, an irrevocable funeral plan can also be Medicaid exempt. Life insurance, depending on if there's cash value or the face value of it. Somebody's primary home can also be excluded from Medicaid. Now, we have on here that the home equity limit for somebody's house is $636,000. If somebody's home is above $636,000, then they are not able to get long-term care supports and services. They're only able to get regular state plan benefits. So it's one of those things where not a lot of people fall into that category. But if you have that much home equity, then Medicaid says you have to pay some of those funds towards your care. Now, if your community spouse, or if you yourself is an institutionalized spouse, intend to return home, then your home is exempt from the Medicaid asset limit. However, that does not mean that it's exempt from estate recovery. And estate recovery is what happens after you pass away. Okay, so those that are over the age of 55 that receive Medicaid benefits have to pay back from their estate the amount of money Medicaid put in. Now, this is not an eligibility requirement, but it's something to keep in mind when you are looking at Medicaid as an option for long-term care services and supports. Okay. All of the assets of a married couple are looked at together. Now, it doesn't matter if the assets are held in the community spouse's name or the institutionalized spouse. Since you're married and you are responsible for each other, we're looking at your assets together. And there's spousal impoverishment provisions that allow the community spouse to keep some of those assets and to, be able to provide for their care. Now, we talk about the community spouse resource allowance in this slide, and we'll go into this a little bit more. There's a minimum and a maximum amount of assets the community spouse can keep and still be eligible for Medicaid. The last topic that comes up often with assets in long-term care is the Medicaid look-back period. Medicaid has a transfer of assets 5-year look-back from the time that somebody has applied and been determined eligible for Medicaid. So if somebody were to be approved today or to apply today, we would look 16 months in the past to see if any assets were given away. And if assets were given away, then there could be a transfer of assets penalty. Now, what a transfer of assets penalty is it makes it so a person is not eligible for long-term care supports and services for a certain amount of time. So the more money that was given away in the last 5 years would make somebody ineligible for long-term care supports and services for more months. And so, depending on how much money was given away, right now, a 1-month penalty is a little over $6,000. So if you gave away $6,000 in the past 5 years, that would equate almost to a 1-month penalty. And it goes up from there and we Medicaid will determine a transfer of assets penalty up to the day, depending on how much assets were given away. Okay. Let's go back to the assessment of assets. Now, an assessment of assets is when somebody applies for Medicaid that needs long-term care services and supports, and they have a community spouse, a spouse at home. What Medicaid does is they go back to the first time that they were, that either person was in a hospital and a skilled nursing facility for 30 days or more. The reason why we go back in time is because Medicaid thinks that you would have had more assets in the past if you have a major medical need. So let's say you've been trying to pay for your own care for the past couple months and you've been in and out of hospitals. Medicaid will say, okay, when was the first time that you were in a hospital or nursing home for 30 days or more? At that point, Medicaid will look at all of the countable assets. So this isn't including the home, if the home is exempt, all the countable assets, both the institutionalized spouse and the community spouse own together. Okay. That amount of assets that's determined is pretty much what is looked at for asset determination. So again, there's a minimum amount and then there's a maximum amount. And let's go through these examples to illustrate what that would look like. Our married couple has a combined total assets of $28,000. Medicaid divides the total by 2 and they get $14,000. So we split. The spouse can keep $14,000 or the minimum, $26,076, whichever's greater. So we would take the $28,000, we would minus it by the minimum spousal needs allowance, or and then we would get $1,924, and that balance is counted as the institutionalized spouse's assets. Nursing home client's asset amount is $19,024, which is below the $2,000 asset limit. And this example, the Medicaid applicant is asset eligible for long-term care supports and services. Okay. Next example, the total assets are $100,000. Again, we divide these in half. So $50,000 is assessed to the community spouse, $50,000 to the institutionalized spouse. This is more than the minimum and less than the maximum. The client would not be eligible for Medicaid until the $50,000 that was assessed to them is spent down below the $2,000 asset limit. One more thing on the $2,000 asset limit. You may be asking yourself, well, how does that institutionalized spouse spend down some of those assets? We have in a later slide, we talk about excess assets in the spending down of assets. But in general, it is to use the assets on you or your spouse's care. So it has to be things that are for you and your spouse's benefit. When we looked at assets in the previous slide, we talked about the look back period. You can't give those assets away. Okay. How to apply for Utah Medicaid. Seniors or those that are disabled, they can apply for Medicaid online at MyCase, and that is through the Department of Workforce Services. They can download and complete a paper application, and those can be found at medicaid.utah.gov/apply Medicaid/. Persons can also contact their local area on aging for assistance, and there's a number given there, 800-541-7735, or they can apply in person at their local Department of Workforce Service office, so that's an employment center, or they can also call Department of Workforce Services at 866-435-7414. Okay. So that was a lot of information on how to determine eligibility for Medicaid. When you think about Medicaid eligibility, what I always say is if you have need for long-term care services and supports, oftentimes it's just a matter of time before you're going to be eligible for those long-term care services and supports. And the reason why I say that is because when somebody's in a skilled nursing facility, that is $6,000 or more per month. And when you have that many major medical bills coming in, it can drain some of those resources very quickly. So how do you qualify for Medicaid when you're over the limits? Well, there's a medically needy pathway. In Utah Medicaid allows those that apply, and this isn't for long-term care. This would be somebody out in the community that is up over 100% of the federal poverty limit. In 2022, the medically needy income limit, or 100% of the federal poverty limit, was $1,153 a month for a single applicant and $1,546 a month for a couple. The spend down amount is the difference between the monthly income, and that's those countable incomes like Social Security, like retirement, VA, and the income limit. So if somebody had countable income that's over, and they're a single person, 1,153, they could spend down that excess income to receive Medicaid benefits. And these are for people that are out in the community. Okay, remember, these are our age, blind, and disabled programs. One more thing to remember is that the asset limit is a lot lower for this medically needy option in the community. It's $2,000 for a single person and $3,000 for a couple. Okay. Spousal the spousal impoverishment provisions only count when we're looking at long-term care. Okay. What happens if somebody's countable assets are over the Medicaid limit? Well, if they have major medical needs, then they can spend down some of those excess assets and become Medicaid eligible in the future. Some things that can be spent, how can things be spent? When we talked about this before, it's on you or your spouse's care. Okay. And so in this slide, we have wheelchair ramps, prepaid funeral or burial expenses. Oftentimes people have a lot of debt, medical debt, that would be able to, be used for these excess assets. They cannot be gifted or sold or given away under fair market value. So what does fair market value mean? Fair market value is if it was sold on the open market. So if you were to sell stocks that are valued at $10,000, but you only sold them for $1,000, that would be below fair market value. Okay. Medicaid does have the look back, and again, that's 60 months or 5 years from the date of Medicaid application. During that time period, Medicaid will look to see if any of those assets have been given away or sold for less than fair market value. And there can be a penalty period for Medicaid ineligibility if they were given away or sold for less than fair market value. There's some references that are available for those that need additional resources. We have the American Council on Aging. There were a lot of things in here by the Medicaid.utah.gov, the SHIP program, things like that. So I will stop sharing. And Darren, did you have any final thoughts here?
Yeah, I have some questions to go through with you because kind of this is what people will ask us if they come talk to us about Medicare and Medicaid questions that you can help the audience be aware of. So let me just ask you an example. So what would be an example of a person, let's just say an older couple that the spouse is the caregiver to the husband, and things are starting to get worse where she cannot take care of him anymore. And she comes to you and she's thinking about Medicaid and long-term care. What would be kind of like an example of what would you tell her to do to help her to apply for Medicaid? And what are usually some of the steps that that person would have to go to while they're applying for Medicaid?
Oh, great question. And, this is not an easy answer. The first thing that we have to do is we have to encourage everybody to apply. So if you feel that Medicaid can be a program to help you not only with long-term care supports and services, but for other needs that you have for medical expenses, past due medical bills, please, please, please apply. That's the first thing I would tell everybody. But what can you expect from the Medicaid application process? I get these questions a lot, and people say that their medical insurance, sometimes private, sometimes Medicare, will cover most of the expenses that they're incurring right now. But they do know that the spouse that they're taking care of is going to need more help than they're able to give into the home. And so at that point, what I try to encourage people to do is I encourage people to contact Area Agency on Aging to inquire about the aging waiver. I encourage them to contact the Office of Long-Term Care Supports and Services to inquire about New Choices Waiver. I encourage them to go to Medicaid facilities or go to Medicare.gov and look at different facility options that could be available to them and their loved one. And so start to develop the process of finding exactly what level of care their loved one needs and what would be the best place, the most suitable place for them to get that care in. This can also run at the same time as a Medicaid application. And so I would encourage people to start that Medicaid application and to start gathering those resources of places that that can help them with that medical level of care. Now, with that being said, there is a lot of paperwork that is inherently associated with a Medicaid application process. During the slide deck, we talked about the look back period, which is 5 years. So you could potentially need 5 years worth of medical or worth of financial documentation. Usually that's not required with a Medicaid application. However, it could be. So what I would encourage people to do is to have at least as much financial records as they have available to them. I would encourage people to gather their bank statements and their life insurance if they have any other assets that they have available that they own. If they have trusts or wills, to have those available. And what happens when you submit an application, Department of Workforce Services will then use the information that they receive from the application to start requesting some of that documentation. They should be able to tell you how much, how many bank statements they need, or the last statement on your cash valued life insurance or your burial plan, something like that. So when you talked about the application process, it can be really one of those things that not only is there a lot of paperwork to do, but there's also a lot of questions about getting their spouse the care that they need. So they should anticipate having those things to kind of juggle. Another thing to think about is if they need more time with their application, they can request extensions on the application to get the verifications needed. They can ask the Department of Workforce Services to help them get some of those verifications. Now, the Department of Workforce Service can't get all the verifications that one needs to complete a Medicaid application, but asking for time extensions, asking for help can be some strategies to prepare and to make sure that they do not lose any Medicaid benefits that would be available to them. The application day itself is very important because Medicaid can go back up to 3 months in past months, retro months is what we call them, to look at covering some of those past medical bills. So that application date can be very important.
So you mentioned, going to the area agencies on aging, which has staff that are familiar with the Medicaid applications. But you also brought up a very good point about going to Medicare and Medicaid skilled nursing facilities, because they also have staff or case managers that are also familiar with the process, which is also helpful. Knowing the fact that the person that lady who's trying to take care of her husband doesn't have to do that all by herself is reassuring that there are people that are out there to help with that. But I'm going to throw you some other questions too. What do you think about what's going on in Utah in general, Marcel? Because you talked about, and we have on the slides about the equity in your home. We can have somebody that lives in Salt Lake in the Avenues who bought their house for $70,000 back in the 70s, right? And they've paid off their house, and their house could be sold now for $1 million. Does that mean that because they live in the Avenues and their house is worth, or supposedly worth, that much, does that mean that they're no longer eligible because they're over the equity portion of the application?
So they're not eligible for long-term care supports and services. They could potentially be eligible if they meet all other eligibility requirements for what's called ancillary services. And ancillary services are state plan benefits. We talked a little bit in earlier slides about what those can be, but they don't include nursing home daily rate. They don't include, some of the personal care and the case management that home and community-based waivers can provide. So you can potentially be Medicaid eligible with being over that home equity limit, but you cannot be eligible for long-term care services and supports. And so then we kind of go back to oftentimes people have different things that they can spend their money on to lower that equity amount that is in their home. Things that they need, different activities of daily living, the wheelchair ramp, the medical bills, things like that. Those things can be used with those excess resources, and it's encouraged. Medicaid wants to be the payer of last resort. I said it a couple of times with applying for all other benefits that are available. It does also include using excess resources to pay for your care.
So let me also clarify my statement too. I just want to make sure that everybody understands this. Who determines what the value of your house is? Is it the state of Utah? Is it retail listings? How do they determine that equity portion?
That's a good question. And so we talked about fair market value. Fair market value is if the home is sold on the open market. So oftentimes we will use property tax evaluations. We'll use different evaluations. Let's say that a professional real estate agent found that although the property tax said that this home was valued at $1 million, there were a lot of things that needed to be done to the house to get it ready to be sold. And so they evaluated it at far below the $1 million asset or the $1 million equity amount. Medicaid would look at that, and that professional in the field, we would take that person's word and we would say, okay, that home is valued at $800,000, not the million that the property taxes say that they're valued at, because of all these improvements that need to happen in the home. So we look at the professionals in the field to give us that fair market value if it can't be determined other ways.
So we have people come and ask us questions too. Let's say that it's a widow. This particular gentleman has been living in the home. His spouse passed away 5 years ago. And he wanted to make sure that his dependents are, part of his estate and receiving stuff. And so he put his one daughter on his house. Is that an issue? Because he has, a dependent. He wants to give his house to his daughter. Does the daughter count as something different, or does he still does it have to be 5 years or longer for her to get the house, or as to qualify, or what happens in those types of situations?
Great question. So the Medicaid policy has a 5-year look back period. So if somebody were to grant ownership of their asset to somebody that is not themselves or their spouse, that is considered a transfer of assets. Now, with that being said, there are Medicaid compliant transfers. And if somebody were to gift a home to a disabled son or daughter, that can be Medicaid compliant. But just to gift it to their son or daughter and not have it meet one of those provisions is considered a transfer of assets, and there would be a penalty where somebody couldn't receive the long-term care supports and services for an amount of time.
So the last part I want to ask you is kind of the sticky part, where people usually don't want to go to Medicaid, is because they've heard about the scary side of it, is the mom and dad. Now mom's in the nursing home, dad's at home, kids are still visiting and helping the best they can, but the kids are saying, well, now dad, you're going to lose your house, and once mom dies, and dad's all worried because he's living in this house, and for some reason now that his kids are telling him that the state of Utah is going to come and kick him out. What exactly happens in those types of situations? Is that true? Or if it's not, what exactly happens when a person is in long-term care services with Medicaid? Is there something that happens when a person does that?
Yeah, so Medicaid will not take a person's home. That is something that is handled through the estate recovery process. Estate recovery is something that does happen. As I mentioned earlier in the presentation, if somebody is over the age of 55 and they receive Medicaid benefits, Medicaid can recoup the money spent out on their behalf from their estate after passing. Medicaid does not take somebody's home while they're still living. And again, there are provisions where estate recovery can be waived. If the son or daughter is living in the home and they're disabled, estate recovery can be postponed until that disabled person finds a new home, or they pass away themselves. Estate recovery can be postponed until a community spouse passes away. So the Medicaid isn't looking at taking anybody's assets while they're still living. It's during the estate recovery process after somebody's passed away.
Well, thank you, Marcel. That's a lot of information to share with people, and we're glad we're recording this because we can put it up on our YouTube channels and so forth to have people watch and to decide if this is something as an option to help with their long-term care services and support. If you were to give your 2-minute spot of why you believe that Medicaid is a good option or is the best option, what would you tell somebody to help with some of their fears of, as you mentioned about estate recovery and about the paperwork that they have to go through? Is there a light at the end of the tunnel, something you could just show or tell people to help them with their fears, to help them see the good side of why they need these services?
As I've always been a big proponent for Medicaid, you brought up the fact that I'm part of the policy team for Medicaid. I've also worked outreach in long-term care facilities as eligibility specialist myself in my previous training. I have seen the benefits that Medicaid can give in the quality of not only care, but the helping that it can give people, not only in a skilled nursing facility, but with some of the home and community-based waivers that we talked about, the aging waiver by keeping people in their homes longer, the new choices waiver by allowing somebody the option for assisted living or a lower level of care than a skilled nursing facility. There are so many great things that Medicaid can do to help people. It's a matter of meeting the eligibility requirements and being able to determine what it is to qualify for Medicaid. You talked about the paperwork and things like that. The paperwork is going to be well worth it for the person needing long-term care services and supports to get the care that they need. Again, I might be more biased than some, but I really do believe that Medicaid has great services and we can help a lot. When we showed how little government resources are out there to help people with their long-term care supports and services needs, Medicaid is a huge contributor in helping people not only have good quality of life to get the medical care that they need.
Yeah, I thank you very much, Marcel, because I think that's a very important part for the group in this recording, is that it's along with all the financial burdens associated with long-term care, right? As Medicare moves to non-coverage because Medicare doesn't provide long-term care, it's Medicaid that then steps up and provides that emotional support and well-being for a person who's having tough, difficult times, either the family or the community spouse are trying to figure out how to pay for this, but it gives them that well-being too, that once they're in the facility, they're being taken care of. And there's that financial component that doesn't rest upon their shoulders, that they can sit back and enjoy that institutionalized spouse the rest of their life. If it's going downhill, they can enjoy the time to spend with them and to think about the important things, which is spending time with a loved one instead of having to worry about how am I going to have to pay for this once I leave that door as I walk away from the nursing home. But thank you very much, Marcel. Thank you very much for sharing this information about the process, the requirements. I know this is a complicated situation, but you've made it easier for us to understand. We appreciate that. And any parting remarks as we get close to the end of this?
Thank you, Darren, for the opportunity to not only present the information, but to try to dispel, some of, to recognize, some of the difficulties and some of the burdens and things that people go through. But not only that, but to allow people to see, the benefits that are available to them. So I think that it's so important to try to apply when you feel that Medicaid could be an option to help you. If you wait, you could potentially be using resources that you wouldn't necessarily need to, or looking at things in a way that could make things more difficult on you. Medicaid is there to help people. It's not there to make things more difficult on them.
Well, thank you, Marcel. We're going to redo this presentation again on July 11th at 1 o'clock. Marcel and I will be back again and going over the same topics. And please share with your families and friends this recording, let them know. And appreciate all that time. And I'm going to stop the recording now and we will end our presentation. Thank you very much.